When you or a loved one is hospitalized for an illness, injury, or planned surgery, you may have many questions or be uncertain about the next steps.
It can also be difficult to find healthcare resources that can provide answers, but now there's a way to bridge the gap for seamless care.
Laura Saltman went to the source and learned healthcare help is a phone call away.
Take a look.
Thank you for calling. This is Ernie, a registered nurse advocate on a recorded line. How may I help you today?
I'm here inside the Lacuna Health Call Center, where registered nurses are available 24 hours a day, 7 days a week, to serve as a patient and caregiver resource on behalf of their clients, which include hospitals, physicians, long-term care, and home care companies.
Have you had any falls or stumbles?
And you've been taking your medication as prescribed?
Did you want us to go ahead and set up something for a nurse to come out when she gets home?
Talk to me about some of the services that you provide here.
Yeah, I mean, right now we have over 50 nurses that are on the phones, hard at work, talking with patients.
And you've been walking okay and following up with your doctors?
Most of our nurses are talking to patients that are calling us, or we're calling them, as they've transitioned from places such as hospitals or physician groups and are trying to manage their health back in the home care setting. Lacuna actually comes from the Latin name meaning gap or missing piece. Our healthcare system simply fails patients and their families at this point. It's so constricted in terms of money available to put resources in for patients, and unfortunately what happens to a patient at the worst possible time is they leave the hospital and they have less resources, not more, to help them sort of get back to a standard of health. This is just something I've seen from a variety of different vantage points over the years, and we tried to construct a company that would essentially address that and help deliver something that I felt was missing in our healthcare system.
It's hard navigating the system, so there's always a 24-hour line. Feel free to call us back with any questions or concerns.
Last year we took almost 75,000 phone calls in, and those will come in majority during the day, but certainly over the evening hours as well.
Do you have any questions for me, any concerns?
I do have one question. Does it matter what time of day I take my blood pressure?
You should check your blood pressure normally after you take your medication. So if you take your blood pressure medication in the morning, you take your medication, wait about an hour to an hour and a half, and then check your blood pressure.
Okay, thank you.
You're welcome. It's really nice being able to bring health care into the home for patients who can't get out to the hospitals and to their doctor's appointments because of the various things that's going on with them.
When you're looking at what that can actually do, if you look at something like rehospitalizations, believe it or not, 20% of patients are rehospitalized 30 days after they leave the hospital. And so what we're trying to do is take a look at that and say, you know, at a $17 billion cost for rehospitalizations, you know, how can we impact that?
Unfortunately, what happens is after hours, which too often is 5 p.m., you'll get an answering service, and invariably what you may get is a voicemail. And maybe they call you back within 15 minutes, maybe they don't. So you have all of these folks, say you have chest pain, you know, you can't wait 15 minutes for someone to call you back, maybe. And the person calling back with many of these answering services is not clinically trained. And so the gap that we're filling is providing 24/7 access to a trained resource that can help you think through your particular situation and get you connected to someone that actually can help you with your particular problems.
How may I help you today?
I'm actually looking for some home health services in my area. My mom is going to have a knee replacement surgery next month, and her physician had advised that she will probably need, right after the surgery, either a nurse or a physical therapist to come to the house and help her with the recovery. And I wanted to know if your company had offered any services in our area.
I'd be happy to help you with that. It does look like we have services in that area. And again, you said you would need a nurse and physical therapist for your mother?
That is correct.
I'm going to go ahead and reach out to the branch, and then someone will reach out to you from the branch to get everything set up. Does that sound good?
Thank you very much for your help. I really appreciate that.
Just knowing that I'm able to get them placed so they don't have to feel that weight on their shoulders of where is my loved one going to go. I really feel like I'm able to assist.
These are trained, highly trained clinical nurses, ex-ED nurses, ICU critical care nurses, and to have access to this type of resource 24/7, 365, we think is an incredible resource that's missing in the healthcare system.
Brian, thank you for having us here and being an important part of the patient's journey. Now, where can we get more information?
Sure. First of all, thanks for coming. We're very proud about what we built here, and this will help get the word out across the country. I think the most important thing is Lacuna Health does not replace the conversation that the patient needs to have with their own family and with their physician and care team. And so what's most important here is if they're looking for more information on Lacuna Health so they can have that conversation, we have both a website and a phone number. The website is lacunahealth.com, and the phone number is 1-855-LACUNA-1.
Great. Thank you so much.
Thank you.
Pleasure.
My pleasure.